This looks okay. Okay, continue. Okay, so we are going to spend the next 20 approximate minutes talking about self-disclosure. So just at the most basic definition here, we're just talking about any type of intentional, usually verbal, disclosure of our life as a therapist or as a provider, kind of outside of the therapeutic context. And usually this is a statement that reveals something personal about the therapist's kind of non-immediate experiences or feelings. And I'll talk a little bit more about kind of that difference between sort of an immediate disclosure. And so we've got both like kind of we should be mindful about like what our nonverbal disclosures are. And so these could be things like that we don't really have any control over about what people see and perceive about us. Things like skin color, whether or not we're wearing a wedding ring, what items we have in our office, or what items we have behind us in Zoom. I think these are things that sometimes we think a little bit less about, but they're also, important kind of pieces that we bring into the therapeutic context. And so those are things that we might consider more like unavoidable. And then we'll talk about, what are the things that we have more control over, what we disclose and when we disclose it. So we've got basically voluntary self-disclosure is what we would think of as like we're making the choice as the provider to disclose something. Voluntary, I think of it also in the sense that like we initiate it, right? I guess you always have the choice of whether or not you're disclosing something, but like maybe more like a provider initiated disclosure versus a client requested disclosure. So most of us have had a client ask us a question at some point or another that's more personal in nature. And then we kind of have to navigate this issue of whether or not we answer the question and how we answer the question. So back to this piece about immediate versus non-immediate. So I think we have actually a really good example of the immediate disclosure that Laura just shared with us in case supervision. But the idea of immediate disclosure is this revelation of something about something that's happening kind of live or like in the session. So this might be your feelings about the client. It might be something about the therapeutic relationship. It might be about something else that's happening in session. And so one of the examples I have here is something like, I feel really sad when you describe that experience to me, yet it appears that you don't really seem to be experiencing much emotion as you talk. Another, example that we might think of is, I think Laura's example is a good one of even just commenting on like, whether or not you feel ignored, right? Like if you're feeling kind of steamrolled or ignored by your patient, like that's also an opportunity to sort of share that disclosure of kind of what you're thinking and feeling in that moment that can be really beneficial therapeutically. So this is often used to process an issue that's happening kind of like, again, live in the context of therapy, and can potentially use to bring your client's attention to their impact on others. A lot of times like the therapeutic relationship that we have with our patients, parallels a lot of their experiences out in the real world and interacting with other people. So this idea of a non-immediate disclosure, these are the ones that I think people have more questions about usually. It's kind of this idea of information that's disclosed about your personal life, sort of, hobbies, interests, identities, different sort of parts of our life that our clients wouldn't know about unless we explicitly told them. It tends to be something that the immediate self-disclosure tends to be thought of as something that is very directly related to the client, in that like you're commenting on something about the interaction, whereas the non-immediate disclosure is something more removed from the client that isn't directly related to the client, even if it's kind of impacting the context of the therapeutic relationship, perhaps in like a non-direct way. So there's all these examples, right, of different types of self-disclosures. We can talk about self-disclosures of facts, like where you got your degree from, disclosure of strategies or, kind of insights that you personally have come across. For example, when I was in that situation, I found reducing my screen time before bed really helped me sleep. So if there's something that like genuinely feels true for you, that's sort of one way to kind of deliver that psychoeducation. I think you could see that you could deliver that same information without that self-disclosure of whether or not it worked with you. I think this is kind of client dependent, that some clients might, I think maybe find that really beneficial, that they know that this is something that helped you personally, and other clients like give, no, they really don't care about whether or not it worked for you. So this is something that I think is a little bit harder to predict how that might land unless you really know the patient well. We can talk about disclosures of feelings. So this is kind of that more immediate disclosure that we just talked about of like, when I was in that situation, I felt a certain way. Ideas or sort of disclosure of beliefs or ideology, perhaps around like religion or spirituality beliefs. And then kind of disclosure around identities, so sexual orientation, gender identity, your relationship status, whether or not you're married, parental status, whether or not you have kids, whether or not you're religious, kind of like what your cultural or racial or ethnic background is. These are all things that can also be disclosed to clients. And you can see that there's sort of like a wide range of different things that we might disclose here, and that there's potentially like some are a little bit more sticky than others. So it's, as you can see, there's like a huge range of types of self-disclosure. And so it's pretty unsurprising that you would hear that, most therapists, when they're surveyed, will say that they use some type of self-disclosure. Again, there's like all of these different ways that we might self-disclose. And so since we have this really broad definition, it's not super surprising. So we'll try to talk a little bit more about this sort of last bullet point around disclosure of identities, since I think that's the place that people feel kind of the most uncertain about sort of what to do or what's the best approach to that. In general, self-disclosure is something that you'll still hear people kind of have a lot of different opinions about. It's something that historically wasn't really considered to be a practice that should be included, because if you think about kind of like the sort of history of psychology and where therapy kind of began with, psychoanalytic approaches and sort of more Freudian style therapy, you were on a couch not even looking at your therapist because you didn't want that to sort of muddy your what you were sharing or what you were perceiving. And so it was initially sort of back in the day considered like very distracting, something that you wouldn't do. There's a much more contemporary view now that sees that there are sort of situations where that could be really beneficial, and kind of acknowledge that like when we use it really strategically, it can be incredibly powerful and a tool that clinicians can have at their disposal. But I think in general, sort of the degree to which you use self-disclosure, again, kind of varies across theoretical orientations in particular, which I'll talk more about in a moment. So I wanted to give a little bit of a review of what the literature says on this topic. There's definitely a body of literature on this, but it's complicated, as the slide says, but it's difficult to study. So we want to kind of consider what we're getting from the research and make sure that we're taking that with a grain of salt, because it's something that's really difficult to study. We don't have a lot of great ways to standardize it. If you think about, the methods that we would rely upon for researching this topic, it's basically therapist self-report, so the therapist's perception of this, or it's usually a retrospective client self-report. So like we'll take a group of people and say, did your therapist ever self-disclose, and was it helpful or not, essentially? And so you can see why there's like a whole lot of bias both on the client side and on the clinician side that, would be potentially problematic. And then also if you just think about like, there's just so many factors when it comes to self-disclosure. We already talked about like this huge range of different types of information you can self-disclose. And then you think about like the unique constellation of factors that like each individual client is going to have and each individual therapist. And it becomes very difficult then to compare what people's experiences are. So it's definitely very tricky. The research, if you look kind of like across sort of all the studies that are out there, the findings are also somewhat contradictory. I think, usually our field is pretty good is that if something comes up pretty consistently in the literature that, people will sort of be aligned with that. But this is something that like some of the studies will say, it's really beneficial. Other studies have, shown that it's not beneficial. And so it's something that, like, again, is the literature doesn't really give us like a solid answer. And again, because it's very hard to standardize, it's very hard to study. And so we know that, I think we already covered this point, most therapists usually disclose to some extent some of the time. The sort of the review articles will come back and say that essentially the kind of self-disclosure being used as a I think the language in the study is sparingly, self-disclosure sparingly, ranked it as one of the least frequently employed techniques. So if you're somebody who like uses it like pretty infrequently. You're usually probably somebody that doesn't think that it's as beneficial, you know, which would make a lot of sense. I think there's a couple of correlations here that are important to point out. And so I sort of alluded to this earlier, but there's a big correlation between theoretical orientation, which makes a ton of sense. Different theoretical orientations, I think, perceive self-disclosure very differently. And so it would make a lot more sense that if you're practicing from a more psychodynamic oriented therapy approach, that you're going to disclose a lot less frequency than somebody who's sort of a more humanistic or feminist approach to therapy, which really incorporates self-disclosure as like one of the techniques that's used regularly in treatment. There's also certain settings. So as you might imagine, if you've ever worked in like substance use treatment, there's usually a higher level of self-disclosure, and in places like substance use, a lot of times sort of providers who work in some of those substance use treatment programs have experienced substance use issues themselves, and so that tends to be kind of part of the dialogue and part of the narrative in the program too. We can also see that this is very culturally driven, and I think it's important to point out that the research does a really poor job of capturing this, that sort of the way the client perceives disclosure as helpful or unhelpful is going to really that culture is going to be one factor that contributes to that. Just sort of our expectations and our beliefs about this in the therapeutic context. And so I think again, research is sort of not great across the board as far as its consistency, but I think most of the studies don't really take this factor into account. So just sort of keep that in mind as well, that we don't have a lot of information on that. So if anybody wants to do research on self-disclosure, you've got a whole wide open field. So let me see how many more slides. Okay, yeah, I'll do this one. So the idea of disclosures of immediacy, this is kind of highlighting again our feelings or our thoughts in the present moment, are generally considered to be the most valuable to the client. So usually clients, like if we ask when people are doing research on this topic, we'll ask, you know, people who've been in therapy, like whether or not that's helpful, and they'll tend to rate this type of self-disclosure as what's the most helpful for them. What's also really important is the studies that talk about the therapeutic relationship and how that impacts whether or not it's perceived as helpful. It's not surprising, perhaps, that your therapeutic alliance with a client is going to really color the degree to which the client finds the self-disclosure helpful or not. If you've been working with somebody for a long time, that, you know, your client is a lot more likely to rate that self-disclosure as more helpful, and that you can see why that would make sense, right? If you're working with somebody a long time, presumably you like that person, maybe not, presumably you like that person, and that you are maybe more sort of positively and warmly going to perceive, you know, whatever it is that is disclosed to you as the client. And that generally they find this sort of the opposite being true. For if your therapeutic relationship is a bit weaker, that clients are more likely to say that they didn't find that helpful, or sort of that there's actually more negative, like harmful effects of that. Things like taking the attention away from the client, sort of clients feeling like, you know, I was here to talk about me, not you, kind of reaction that sometimes clients have. So in the context of sexual orientation and gender identity, we know that everybody has a sexual orientation and gender identity. And so, you know, what we sort of our perception and our experiences that we bring into the therapeutic context are really important and definitely impact the work that we do and how we perceive our clients. And so this issue, particularly of like whether or not LGBTQ clients or therapists come out to their clients, is like a question that comes up a lot. And it's also just like a factor that comes up in the lives of LGBTQ people who are sort of navigating whether or not to disclose their identity pretty much almost on a daily basis. And we know that some LGBTQ people want, at the very least, you know, to seek out somebody who's affirming and knowledgeable in LGBTQ issues, and that also some people would prefer to see somebody who identifies as LGBTQ. So it sort of puts you into this weird chicken and egg process too, of like, if a therapist is looking for a particular if a client is looking for a particularly identified therapist, that there would have to be some way to know that identity about the therapist ahead of time. So, you know, I think this also is really important to consider in this context, that we all know that we live in this very heteronormative, like cis sexist context, where these, you know, heterosexual and cisgender identities are really prioritized and really sort of socioculturally like valued over LGBTQ identities. And so I think there tends to be a feeling about not wanting to kind of collude with the heterosexism, in the sense that a lot of times heterosexual therapists will self-disclose without really thinking much about it. Like they, for example, I personally know a lot of people who like have a picture of their partner or their family on their desk or in their office, which is like very clear and, indicates that they're sort of at least sort of the makeup of their relationship. And I think that can be something that like LGBTQ therapists would think about a little bit more carefully, and that there's sort of like no easy answer here, but there's definitely, I think, a level of thought that goes into it oftentimes, that sometimes heterosexual therapists don't think, because a lot of times when you sort of move through the world, being heterosexual, you sort of don't think about disclosing your identity. That's just sort of who you are. But like every time you mention sort of the sex or gender of your partner, that there's a disclosure happening there as well. So in our last 3 minutes, there's a slide here about kind of what the pros and cons are summarized from the research. And I want to, which I think we've touched on some of these. Well, maybe I'll go through these ones and then, yeah, I think we can get it all in. So the pros are like, they're going to be different again for sort of like what our purpose is for self-disclosing. So some of the reasons that we might self-disclose would be to sort of reduce that power differential between the therapist and the client. It can sometimes reduce sort of that intimidation, particularly working with youth. Like I'm much more likely to self-disclose what my hobbies and interests are outside of work and working with a teenager than I would with an adult, where there's sort of like other easier ways to build rapport. It can be modeling, right? If we're disclosing sort of how we're thinking or feeling, that's a good way to model what it's like to share these internal experiences if our client is having trouble doing that. It can potentially build trust and rapport with our client, and it can potentially validate experiences of our clients. Some of these are also, on the flip side, can also be kind of drawbacks. And so some of the cons of self-disclosure might be that it can kind of compromise that professional relationship, and that the client might see you more as a friend, which can potentially be more problematic down the road. It can move the focus away from the client, and sometimes clients perceive that as invalidating. It's like, I showed up here to talk about my things and I don't want to talk about your things, essentially. And it might make the client kind of hold back or be burdened in some way once they have additional information about you. They know certain sort of parts of your identity. They might want to kind of protect you. They might not share certain things that they would have shared otherwise because they're worried about how you might think or feel about it. I think it can also sometimes present some undue pressure to have the client disclose certain things if they see like, oh, my therapist shared X, Y, and Z, so that maybe makes me feel like I should share those things. And that there's this idea that like, just because we have a shared identity or a particular identity doesn't mean that we necessarily understand our client's experience of that identity, since it, can be very different, even if part of it is shared. And so I think there can be an inadvertent or sort of a way of sort of potentially thinking that you understand your client more, like, oh, I have this shared identity, then like, this is fine. Or the client perceiving that is the reason for it as well. This slide is one that I want to just make sure that we have a minute to go over, which is like, so what do we do when we're trying to decide whether or not we self-disclose? This is a good way to just kind of ask yourself, like, why am I telling? Like, why do I want to share this information? And I think usually if there's a way to do it that like doesn't involve self-disclosure, if you can kind of get there in the same way, that generally speaking, that would be a good way to go. I think it also depends on why you're wanting to disclose. So if it's something like seeking validation from the client or wanting the client to like me, those might be reasons that would be better not to self-disclose about. There's a lot of other reasons, again, that sort of vary a lot by theoretical orientation, but trying to find that more client-therapist relationship to be a little bit more egalitarian. And I think that's particularly important for some clients, that there are clients who do better with somebody who sort of seems like more an authoritative position, like somebody who's sort of more of an expert. That's not, I think, generally how we're trained as psychologists, is to sort of see ourselves as like more of an expert and in like more authoritative position. But I think, again, that's going to differ for different clients. This issue about the power differential or modeling, correct sort of communication around thoughts and feelings. So you can see there's like, this is just an example of some of the studies, like had charts of these. So these are some of the ones that come up. There are obviously other reasons that people self-disclose, but just kind of pausing and like giving yourself a moment to really consider why you were self-disclosing is a really good practice, is a good practice to have. And so I know we're out of time. We have a couple of discussion questions that I'm hoping, I have to double check our didactic schedule for next week. I haven't done that yet, but if we can get to some discussion next week about this topic and sort of self-disclosure and what people have done and how it's gone, and some anecdotal, stories about that might be a helpful way to kind of finish up this topic. So that was my whirlwind. I did it faster than yesterday though, so. So I guess with